Hi, I'm Olivia Reynolds with Healing Hearts Trauma, and today we're going over emotion regulation. Everyone's been asking about it, what it is, and why do we use it. Well, when we talk about black and white thinking, we're going to get in our emotions. We either emotionally dysregulate or we dissociate, okay? They're interchangeable and we do both, believe it or not, depending on the situation. We might get our emotions first, have a little bit of dysregulation, and then shut down and dissociate. When you watch my videos on the fight, flight, freeze, or fawn, flight and freezers are very much dissociators. They would rather avoid conflict, keep themselves busy. If they're the flight type, they might obsessively work to keep themselves from having any type of communication. So emotion regulation. This is the DBT manual. This is usually taught in a PHP program or some type of a you can do it in an individual session, but it's a lot harder. It needs to be taught 3 or 4 times a week to effectively work and use it. But you can learn it if you're not as intensely dysregulated as often. So the biology behind regulation is the amygdala, right? The little tiny almond shape. My nails are shaped almond, but it's the emotion center of our brain, and it's so little. So when things happen to us, such as trauma or anything causes emotional stress, bang, it is completely incapacitated. When it is completely incapacitated, we have no control over our emotional response. We can do things to kind of deactivate it, and it's based on sensory. So we learn a grounded technique, 5, 4, 3, 2, 1. However, I tell people really do the things: smell, taste, feel, hear, and see. I don't want you to just name those out. Like, taste things. One thing we've learned is sour and hot are very good skills for regulation when we're feeling some type of way. So if you're feeling anxiety or panic, you could regulate quickly by biting into a lemon. If you look up lemon response on the nervous system. So again, the amygdala gets hijacked, the nervous system and the parasympathetic nervous system starts to get hot wired. You're going to go through all kinds of things. So when we're over in our left brain, or more so on the dysregulated side, we are ruled by our emotions. We are not ruled by facts. And in fact, if we go on the extreme side, we're going to be a bunch of Carrie Underwoods. Like, I dug my key into right? Because we don't care. We're over here in this emotional side, right? Once you hit that throttle, if something really upset me, it's all or nothing over here, right? So there's extremes on both sides. Typically, we can do things to try to work it before then, but depending on what led you there, right? Emotional stress, something that really hurt you, you're going to dysregulate. And it's extremely hard when that amygdala is slime, and you have to do a lot of work to get that emotional out. And this is why we see crimes of passion, because when someone's very emotionally driven, they are going to stay over there. So they're not ruled by facts. I call this side the bunny boiler, essentially, when they're very upset. We often see this more in bipolar disorder, people with potential personality disorders such as borderline personality, trauma. There's lots of reasons why we get over here, but every one of us experiences emotional dysregulation at some point. Now, there's some things we can do to kind of, again, get us ourselves back out of this, right? So showering, ice cold water, going for walks. There's tons of resolution skills in here, learning mindfulness. And mindfulness is not just doing like yoga or meditation. It's more like learning to be in the moment. There's a video I highly recommend to everyone on a TEDx, and I'm a big TEDx person. I watch a lot of videos on there and content because they have a lot of useful things. It's called 5 Chairs, 5 Choices. It's a great video of an explanation of what it would look like if we could get out of black and white. Black and white is all or nothing. Katy Perry wrote a song, we're high when we're cold, we're yes when we're no, we fight, we break up. We want to break that cycle. Black and white is all or nothing. Again, left brain versus right brain. It's either you're good or you're bad. And we talk about the communication video. If you've not seen that, we're talking about we judge our partners. It's all or nothing. And then there's no healing. There's going to be no resolution. We're just going to be resentful, shameful. We're going to label them as bad. And then you're never going to look at them differently. But you can. You can learn to pull that back by regulating yourself and getting to either the middle, which we would call in the video, if you watch it, it's the middle chair. They use animals. And this is where we want to learn to start to be pulling back. Wait, what am I feeling? What am I thinking? What do I need? Why am I feeling this way? And ultimately, like, why do I feel this way about this person? Because this person isn't solely responsible for my emotions and how I feel about things. It's usually internal. These are wounds usually relived from the past, which watch my next video segments on the emotional wounds from trauma, childhood wounds. We have shame, embarrassment. There is fear. There is anger. There's a bunch of them. And literally they often happen, betrayal wounds happen before. So if someone just did something to me, it might feel really intense, but trust me, it's not this person right here that caused this. It is something from roots and roots of past that we have not broke that cycle and healed. So we keep reliving it with other people and then thinking it's them. You did this to me, so you're the blame. No, it's not. These are wounds that are far deeper than this person right here. Most of the time, what people don't realize is when someone's hurting us directly in front of us, it's not that person causing it for you. They didn't want you to hurt. But we mirror each other sometimes in negative ways, and we see those wounds that each other's have and those blind spots, and then we're just lashing back and forth. So learning how to heal those are going to be important. So emotion regulation, you can do the hot versus the sour. You can do radical thinking and radical acceptance, only what's accepting what is in the moment. Being able to, I teach my patients, love these phrases, not today, Satan. I'm doing the best that I can, and I'm going to have to keep trying harder, right? Give it love, light, and let it go. When you can give someone love and you can give them light, positive energy, then it's not holding you. What most people think is mindfulness is the ability to be in the moment and not hold resentment. The more resentment you hold is making you heavy. We want to be light. So the more light you become, you don't hold on to this. You don't hold on to resentment. It won't hurt you and can get over it a lot faster when you become light. So give someone love and light and let it go, because it's not you. It's a them thing most often, or maybe a you thing. But once you learn to let go whatever that hurt is from the past, you won't be punishing this person in front of you for something from the past, right? Okay, this person messed up. I'm giving them some empathy, some understanding, and we're going to move through this. All right, so give him love, light, and let it go. Not today, Satan. I'm doing the best that I can. And is this effective, right? Is this effective for me to stay mad at this person for 4 or 5 days, weeks, months? No, it's actually not effective for me. What I'm doing is I'm harboring resentment. I'm harboring shame. I'm harboring a bunch of feelings that are going to stay stuck right here until I say, you know what? This stuff is accumulating in me and it's not effective. We want to do things that are effective for us. Mean it's working. It's causing some type of positivity. So let it go, right? Let them and let the universe have it and say, I don't want it anymore. I want good things. I want to look at these people that I care about and see them as good and wholesome, and that we all just make mistakes and things happen. And it's not always about this situation, right? So shame wounds are rooted, embarrassment, jealousy. There's so many of them that the person in front of you, we hold things so deep. It's because it's been done hundreds of times. And until you live that trial and tribulation, you are going to keep reliving that wound. All right. So, and right here, we're looking at shame wounds, like being reminded of something's wrong with you. No, there's nothing wrong with you. That's a shame wound. Someone else from the past has tricked you into believing that you are a failure, you're not good enough, you're not worthy. And these shame wounds will definitely trigger an emotional response. Now, dissociation on the other side of this is once you feel the emotion and you don't want to deal with it anymore, like done, numb, shut down. We go into either fight or freeze, which is not good either because we're suppressing, which means it's going to be relived over and over and over. And even if you don't deal with it here, trust me, your next 5, 10 relationships, you're going to keep reliving it. So if you can learn to embrace and heal, have people help you, talk to people about this stuff, learn what your wounds are. There's guilt wounds. There's shame wounds, there's embarrassment, and many. So I try to keep this short. Emotion regulation, look up some skills, DBT, I have more to come. This is Olivia Reynolds with Healing Hearts Trauma. Thanks for stopping. You can follow me on Instagram, YouTube, and Facebook at Healing Hearts Trauma, as well as TikTok. Thanks, have a great day. Please share and subscribe.